in the consumer market where patients aren't going to pay attention to notices if they get them all the time. It would be nice for the government to keep that in mind if someone makes an argument that they didn't notify because they didn't feel there was a real need to do so. It would be nice to keep that in mind, but what has happened in reality is that every single time there's been a breach, the government has expected that there's notification to be done. There's very few instances that are documented where they've agreed that there was no harm, no foul, no need to notify. So just something to keep in mind. And of course, business associates are now directly liable under high tech, but the government to date has said they're not really right now looking to go after them as aggressively as the actual provider of the care. So we'll skip this slide. This gives you just a quick overview of what we've already touched on in terms of, but one thing I do want to point out, the second bullet, under high tech, actions can now be brought by state attorneys general. This is passing the baton to the state AGs, where the federal government is very busy in terms of auditors that are looking at breaches. So the state attorney general can pick up the baton and go after an organization who's had a data breach. This happened in Connecticut several years back. The state attorney general at the time, Richard Blumenthal, who's now the federal senator in Washington for the state of Connecticut, really rode that data breach for a lot of political capital, and there are other attorneys general who are very aggressive as well. An argument could be made that there's a great political stage for them to really pick up that baton for the cyber liability data breach ability that they have to act on behalf of the federal government and go after an organization for a data breach and ride that to their own political advantage. So that's an issue. Minnesota is dealing with a very aggressive attorney general as well right now in that regard. But that's a significant additional piece of authority under the Act. Not just the federal government, but the state attorneys general can prosecute for high-tech Act violations as well. Okay. So these notification requirements under HIPAA high-tech just spell out that breaches involving under 500 have to be reported to Health and Human Services up to 60 days after the calendar year when the organization discovers the breach. If it's over 500 patients that were affected, then it has to be reported to Health and Human Services at the same time that the patients receive that notice. And very important to remember that while an organization that provides care can delegate that notification responsibility to their third-party billing vendor, for example, business associate, the ultimate liability, okay, for fines and penalties, et cetera, for that notification to be done right rests with the true owner, okay, of those protected health information records, which is the provider.